now come to a highly controversial topic. Till a couple of topics prior to this, we have all had smooth sailing, nice topics, sweet topics, topics which brought a lot of joy and happiness to the minds, hopefully, of the viewers, and especially when it comes to subject-specific medical entrance examination. This is one terribly frictional issue that is plaguing our nation. Plaguing, plaguing, virtually plaguing our nation. What is this topic that medical education restructuring curriculum is going to present? Diplomate of National Board degree, DNB degree and Doctorate of National Board degree. Time to scrap, time to remove, time to rename. This is the topic of today's discussion. In order to understand this particular segment, I must request the viewers to have I request you to have a little bit of patience, because without a thorough, vast foundation or introduction or preamble, preface, prologue, it is not possible to understand this topic. As a question, I would like to ask to the viewers, if I directly ask a question, what is DNB? 99% of the Indian population will not know what is DNB. If I ask, or if anybody in the medical field asks, what is Dr NB? No human being across the face of the nation, excepting somebody in the medical field, will know. If I ask what is MChir, Magister Chirurgie, nobody will know. Therefore, a detailed explanation is needed. Introduction. As we all know, from time immemorial, we have had many degrees. One was LMP, grand old British days, licensed medical practitioner. Then came MBBS, then came MD and MS. Now, in the year 1975, the government of India, as an act of parliament, with a very lofty and very noble and appreciable idea, it introduced a particular degree. It took a decision to upgrade the system of postgraduate medical education in India. No doubt that is an excellent idea. In order to do so, already MD and MS were existing. They wanted something higher than this. They wanted something that is on par with the British degrees or the American degrees. So, they came up with an idea to introduce a degree known as Diplomate, D-I-P-L-O-M-A-T-E, not a diplomat, Diplomate of National Board. They introduced something known as National Board of Examinations, and they introduced a degree known as first it was known as Dip and B. Dip means Diplomate of National Board, NB. Then it became Diplomate National Board, DNB capital. Now, this particular degree was introduced in a result with a view to introduce a very high system of education. Up till here, fine. No doubts, no arguments, no nothing. But then, unfortunately, this is where it began and this is where it ended. Only the idea was lofty. The philosophy was noble. But as usual, when it comes to execution and implementation, that entire program not only fell flat, it not only went berserk, not only lost direction. Today, as of today, this DNB degree, which is specialty degree, and super specialty, it has now, instead of DNB super specialty, new term has been introduced, Doctor capital N capital B, Doctor NB. Some new degree, some new nomenclature, some new name has been introduced. Both these two degrees, in other words, these two national board degrees have become a curse to this nation as far as postgraduate medical students are concerned. I know that these are very harsh words, These may be appropriate or inappropriate, but then let me first clear the air by saying that I have done my DNB, I have done my MBBS from St. John's Medical College. I have done my DNB General Surgery from St. John's Medical College, and I have done my MCH Cardiothoracic Surgery from Sree Jayadeva Institute of Cardiology. So I have had everything, reasonable exposure to, I know what is this DNB degree and I know what is the regular MCH degree. I know what it is all about. So I'm not just trying to speak something rubbish or something without foundation. I repeat what I say. This has become a curse to this society. After MBBS, up till MBBS, there is no confusion. There is just one degree known as MBBS. After MBBS, there is a graduation degree, post-graduation, sorry. That is MD and MS. MD stands for Doctor of Medicine in the medical specialties. MS stands for Master of Surgery, surgical specialties. MS General, MS Ortho, MS Ophthalmology, MS ENT. After this, there is super specialization. Super specialization degrees are known as, for medical, it is known as DM. DM Cardiology, DM Nephrology, DM Neurology, DM Gastroenterology. For surgical super specialties, it is known as MCH, as is displayed on your screens. So this MCH stands for a super specialization degree. Super specialization means cardiothoracic surgery, neurosurgery, plastic surgery, renal surgery, that is genitourinary surgery, urology, MCH oncology, that is cancer surgery. From time immemorial, these are the 4 degrees: MD, MS, DM, MCH. Specialty, super specialty. Medical line, surgical specialty, broad specialty. What is the configuration of these? MD and MS examinations, or for that matter, DM and MCH examinations, are conducted by an All India entrance examination. Student writes the entrance examination and secures a seat. He or she joins MDMS or DMMCH after undergoing 3 years of training, whatever it is, the course. The final examination is held in the same medical college, in the same hospital, where the student has spent 3 years studying. Point number 1. Point number 2. The student's professor, head of department, chief, or whoever it is, will be the internal examiner. He or she, there will be 3 other external examiners, totally there will be 4, but all said and done, it is a doctrine of common knowledge that the internal, they will have a say in the matter. In other words, they will be there. I'll put it in very simple English. They will be there to pass the student. Provided, of course, he is reasonably intelligent, he or she, provided he or she has reasonably worked hard, leave those things aside. If there are any ups and downs of the examination also, things will be taken care of, meaning a good word will be put in with the external examiner, because on a given day, even a great batsman also can get bowled out for the first delivery. Even a great bowler can get hit all over the boundary. So things can go wrong. But there is always, in short, there is a professor, there is your own teacher to support you. Last but not the least, I repeat, you are on familiar ground. You are in your own hospital and you pass the exam. So, I repeat, MD, MS, DM, MCH are those courses which getting into is difficult, because there is a huge competitive All India Medical Entrance Examination, All India Super Speciality Examination. Getting in is slightly difficult because you have to get good marks here. But once you get in, you are taken care of because of the things, because of the factors just now as I have elucidated. This is the complete up-to-date information about MD-MS and DM-MCH, which I have put it across very simply. Nothing more needs to be known as an introduction. When we come to this DNB, which was introduced in 1975, and up till now, the first thing that the government of India, I'm not talking about which government, I'm not talking about this government, that government, I'm not, the policy makers, they got into their mind that they have to create a degree which is on par with British and American degrees. So what do you do in order to achieve that goal? Common sense or usual thing dictates that you have to elevate your standard of education from the grassroots level. Basically, the standard of education that is imparted has to be elevated. But then, this is not what they did. What they did was something that was drastically opposite. What they did was, they announced that this DNB degree can be started at any and every hospital, whether it is government, private, aided, institute, non-institute, that is even corporate hospitals. Anybody and everybody can do DNB. How? Modality. They introduced what is known as DNB entrance examination, a separate entrance examination. A student just needs to get 50% in order to qualify. So, the moment the student qualifies, it is not like that All India PG medical entrance wherein you have to score 600 out of 500, 559, 560. No. You just need to score 50%. You go around applying for all the colleges where there is a DNB vacancy, so to say. So, there is a hospital, there is a vacancy. You go and give your application. They say, yes, there is a seat vacancy, you can join. The student joins. 3 years he or she works. There will be a consultant. He or she is supposed to teach on par with British standard, on par with American standard. The government did not do anything to ensure, governments rather, did not do to ensure that this happened. There was something else drastic decision that the government took, and that is the final exam, in contradistinction to the MD, MS, DM, MCH examination, will not be held in the same hospital where the postgraduate has worked. Instead, the student at the end of 3 years has to go to some center, some external, outside, unknown center in any state all over the nation, where there will be 4 unknown external examiners, and he or she has to face these 4 examiners. And last but not the least, the government introduced one more draconian policy, and that is, just to show the West that we have a very high standard examination, they introduced a very high failure rate for this DNB examination. In other words, even as today, people are failing left, right and center in this examination known as DNB examination. Once, twice, thrice, 4, 5, 6 times, repeaters. They are just going on repeating, they are failing. No job, no degree, no future unless they pass. Why? Why has this happened? What are the mistakes that have happened during this evolution of this so-called degree known as DNB, and as I said, Dr. NB, which stands for super specialty degree. MDMS is supposed to be equal to DNB. DNB is supposed to be touted as being equal to MDMS. But I quote, when you read this particular article, it will be very clear that the Parliamentary Standing Committee on the Health recommended that DNB will be equal to MD except in teaching. Why? Because as Dr. K.S. Rabindranath, former Vice Chancellor of Rajiv Gandhi University Health Sciences said, DNB training is not uniform throughout the state. There are some good centers, but many centers are not up to the mark. The students may get away with theory marks, practical exposure will not be adequate. After DNB, 1 year experience is required in an MCI recognized higher center. Up till then, they cannot get a teaching job. In other words, the first mistake that the government or the administration did was, you started with an idea of creating a degree equal to MD. Now you are saying that this is not equal because you don't have any teaching experience or whatever it is. Why did you allocate these centers to those hospitals which don't have these facilities then? Mistake number 1. Mistake number 2. It is a well-known fact that MDMS is supposed to be equivalent to DNB and DNB is supposed to be equal to MDMS. But there is a very quixotic rule. After MDMS, these people armed with this degree can take DNB examination as an additional degree. So their final degree will be MD and DNB, MS and DNB. They can get 2 degrees. Whereas DNB students are stuck with only 1 degree and they cannot do anything like we can also go and take MS degree. No, there is nothing like that. You say that MD and MS is equal to DNB, DNB is equal to MS. Why are you allowing MS MD to take DNB degree? Why don't you allow DNB to take MS degree? Why are these people, you say when MD and MS are equal to DNB, why are you allowing the MD MS people to take an additional degree? Mistake number 2. Mistake number 3. The very word, from 1975, nobody has thought of this word diplomate. I quote, which is there on your screens. What is the definition of a diplomate? MATE. A person who holds a diploma, according to Merriam-Webster's, especially a physician qualified to practice in a medical specialty, is known as a diplomate. Diplomate is a professional who has earned a diploma. Why key? Diplomate, noun, a person who holds a diploma. Oxford Dictionary. Diplomate, medical specialist whose competence has been certified by a diploma granted by a professional group. Princeton's Word. Diplomate, a professional who has earned a diploma. Dictionary. Other dictionaries are there, the viewers can go ahead. In other words, from 1975, every student, including myself, have obtained a degree known as DNB, which is known as Diplomate of National Board, which we have obtained by studying for 3 years, which is equivalent to a master's degree. But at the end of the day, what does the name say? It is a diplomate, it is a diploma. So we have all been given diploma. All the students across the nation who are holding DNB, technically, legally, they are diploma holders, despite the fact that they have studied for 3 years in order to obtain a master's degree. This is the third critical mistake. A person who has studied for a degree, a master's degree, a 3-year degree, has been given a diploma. Why? That is what dictionary says. Diplomate is nothing but a person who holds a diploma. What is the answer to this? Point number 4. Not only is this so-called diploma being attached to the master's degree, that is the postgraduate degree, even to the super specialty degree. After 3 years, after MBBS, a person obtains a degree, postgraduate degree. After that, 3 more years, a person gets a super specialty degree. Even the super specialty degree was being called DNB super specialty. That means diploma in super specialty. A super specialist is somebody who holds a diploma, is it? As if this were not enough, recently, one more degree, Dr NB. That means they took out DNB super specialty. Super specialty degrees now are being not known as DNB cardiothoracic, DNB neurosurgery, etc. They are known as Dr NB. What is this Dr NB? Doctorate of National Board. What is this? What are these names? It started with MNA MS. That means member of the National Academy of Medical Sciences. Then it became DipNB. Then it became Diplomate of NB. Then it became DNB. Then it became Dr NB. How many names do you want to go on giving to this? In the West, do you have such things? What is the degree in America? MD. That's it. What is there in United Kingdom? FRCS. That's it. What is there in Australia? FRACS. Fellow of the Royal College of Australian Surgeons. Why do you look at other countries? Look at our own nation. For business management, how many degrees do you have? 1 degree, MBA. For chartered accountancy, how many degrees do you have? 1 degree, CA, ICWS CA. For engineering, how many degrees do you have? 1 degree, BTech, both are same. Post-graduation, MTech. Doctorate, PhD. Arts, BA. Education, BEd, MEd. Everywhere you have only 1 degree. Why is it that for medicine, you are having so many degrees? I mean, do you in engineering, do you have some degree known as, let us say, member of the Academy of the National Bureau of Indian Technology of Engineers Man-Bite? Do you have something known as FAT-B, Fellow of the Association of Technical Board of Indian Engineers? Do you have something known as DISCO, Diplomate of Indian Society of Council of Engineers? Do you have these crazy degrees? DISCO, FAT-B, Man-Bite. Does engineering stream have such degrees? Forget this. We have something known as Open University. We have so many Open Universities. Every state has an Open University, etc. A person does BA from Open University. A person does BA from a regular university. Are the two degrees different? He or she is given BA, here also it is BA. PhD from Open University, PhD from a regular university, both are given PhDs. Here, do they say PhD bracket open, or do they say give a degree called Dr. Phu, Dr. PH, Doctorate of PH? Do they give some, I mean, I don't know what to say, absolutely ridiculous names. Do they give like this? No. And last mistake, the most terrible mistake that the policymakers have made all over this, all through these years. What they did was, in order to, I repeat what I already said, in order to impress upon the West, or whatever the reasons may be, that this degree is on par with British and American degrees, they introduced a very high failure percentage. People began to fail. I still remember in a few years ago, in one of the orthopedic examinations, out of 100 students, some 80 to 86 students failed and only 14 passed. Can you have 86% failure rate in any examination? I mean, if there are 86 students who are failing, it is not a great thing. It is in fact a shame on the system, because that shows what kind of a teaching that is happening, what kind of a training that is happening. And if that is the kind of a training happening, the automatic question will be, why did you allot DNB to such hospitals who are sending students where 86 of them are failing? On one hand, you say that you want to upgrade the system, and on the other hand, you are failing students. They may have failed because of poor performance. Let us accept it. But the question is, why are they performing poorly? Because they are not being taught properly. And if they are not being taught and trained properly, and if they are being trained poorly, why did you give permission to start DNB in that hospital or that college or that center or that institute? In other words, the critical mistake that the policy makers made was that they created two parallel systems of education. Their philosophy was correct, their idea and ideals were correct. What was that? They wanted to upgrade the system of Indian system of surgical education, medical education, postgraduate education. Very good, very fine. Nobody denies that. What is the way to do it? You upgrade the system itself. What did they do? They introduced another parallel system of education. They handed it over to hospitals which were either poorly equipped or ill-equipped, where there was no teaching, where there was no training, where the residents or the trainees or the postgraduates were just acting like personal assistants, going on writing and assisting day in and day out, not getting surgical chances, not getting any academic exposure, and at the end of 3 years, they were asked to go to some unknown center, unknown examiners, and go and fail. Day in and day out, 86% failing, 30%, 40% failure. Repeat once, repeat twice, repeat three. I mean, you open the internet, you see the YouTube. I still remember one of the orthopedic consultants giving a program about this. I quote his words. He said, when I sat as an examiner, the PG, the student who had come, he had failed some 4 or 5 times, and this was supposed to be the last attempt. He was desperate to pass. These are the words. You can find them in the internet, in the media. So, A mess has been created. It is not the mess was created. A mess has been created. This is the mess. And as if this were not enough, the super specialty in degree has been named as Dr. NB, as is seen on your screens. What is this Dr. NB? It is the initial of a person. It looks like it is like my name is Dr. Chandra Mouli. In the operation theatre list, it is written Dr. CM. That means I am going to perform the surgery. Coronary artery bypass surgery. Operating surgeon, Dr. CM. It is like that, Dr. NB. Everywhere you will find Dr. NBs. The patients who are going to come, they'll think that how many NBs are there here? He is also Dr. NB, he is also Dr. NB. Which Dr. NB should I go to? It is pathetic. A degree becoming a diploma, being named as diplomate, failure, no teaching, no training. This is what. What is the solution? Medical education restructuring curriculum has only one solution to offer. Scrap this degree, this accursed degree known as DNB or Dr. NB or whatever it is. It has to be scrapped immediately. That name should go, and there should be a uniform degree all over the nation. Yes. How does it matter where the student studies, where the student obtains his training? What matters is what is the quality of training that is being given. Just because somebody does a training in a particular hospital, he or she will be given a different degree. Just because somebody else does a training here, he or she will be given a different degree. Is it? Is this legally correct? A person does BA from Baroda University. A person does BA from Indira Gandhi National Open University or Mysore Open University, Karnataka Open University. Both of them are getting the same degree, BA, B.Ed, MCom, BCom, etc. Then why are we having two different degrees being given? Is this legally correct? For the same degree, for the same training, for the same textbook, for the same subject, for the same knowledge, for the same period of time, for the same 3 years, one person gets a master's degree, another person gets a diploma, is it? Technically known as a diploma. English wise, it is known as a diploma. Vocabulary wise, it is a diploma. This system has to be scrapped. Therefore, the first proposal by MERC is uniform degree all over India, MD, MS for medical and surgical specialties, broad specialties, DM, MCH for medical and surgical super specialties. One entrance examination for all surgical seats all over India, all medical seats all over India. Entire pool of seats will have only one examination. If I am not mistaken, I think this has already been implemented. Most important is not where this is a DNB center, this is a MD center, this is a Diplomate of National Board hospital, this is a MD hospital, MCH hospital. That is not how the course needs to be conducted. That is not how you divide. The question of division must not arise at all. What should be looked at is course content. Every hospital, irrespective of whether it is a private hospital, nobody says that you let private hospitals also conduct MD, MS degrees. Let private corporate hospitals also let them conduct the same degrees, MD, MS, DM, MCH. What's in a name? It is not the name that matters. It is the course content that matters. So, the government has to focus, the policy makers, the administration, they have to focus on the course content. It is not the physical place that is important. The course content is important. Whether there is a logbook based, and regarding course content, we have just now spoken about, there should be a logbook, there should be a mentor, there should be a rotation through units, there should be adequate exposure, certain number of cases have to be drawn, and these at least 70 to 80% of the target must be met. There has to be an apex body, and the apex body has to interact with the students, and there has to be 30 to 40% or whatever it is internal assessment marks. And last but not the least, the same what we spoke regarding the surgical training, final exit exam will be in the same hospital for everybody with 4 external examiners. No internal examiners, no favoritism, no nothing. Everybody, there has to be a uniform system of education. To give an example, whether you buy a particular product from a supermarket or whether you buy it from wholesale, whether you buy it from retail, online, whatever it is, how does it matter where you have brought it from? What is important is ISO 9001 or FSS, CAAI, whatever it is, whatever that seal is important. That is what is defining a standard. Why are these known as standards? This is because no matter where you buy it from, you may buy it from a small shop or you may buy it from a huge supermarket. The seal of quality is important, which in turn reflects that the content is genuine, the content is 100% acceptable. I request the viewers to have a look at it. Achieving uniformity is the primary goal. You cannot have one rule and one pattern and one degree and one system for one set of students and another rule and another degree and another name for another set of students. When both the set of students are studying for the same degree and same education. 2. Ensuring that there is a fair conduct of final exam by all 4 external examiner panel by an invigilator at the exam center who will ensure that there is a fair conduct of the examination. Conclusion: one nation, one law, one constitution, one nomenclature, one entrance, one system, one exam, one degree, one uniform educational code. The viewers will have one final or rather I would say penultimate question, and that is, as per this MERC's proposal, the National Board exam, the so-called DNB exam, degree of course, MERC has put across very clearly that this degree needs to be scrapped and there has to be uniform degree all across the nation. Having said that, this DNB exam, will it be totally defunct? Will it be taken out? There will be no more DNB exam? MERC would like to answer this question as follows. There will be a DNB exam. Only thing is, it will be renamed as MS or MD, DM or MCH with National Board certification, that is NB, as is displayed on your screens. What is meant by this? It means to say that first, as stated above, every postgraduate will take his or her final exit examination in the same hospital, institute, college, corporate hospital, private hospital, wherever it is, where the person has completed 3 years of training, there itself he or she will give the final exit exam with 4 external examiners. Having thus obtained an MD, MS or a DM, MCH degree, this, first of all, primarily, this will ensure security to a professional. So, this provides job security, employment security, financial security, professional security, social security. Once this has been, this is something, this is the minimum thing what everybody deserves. This being the case, following this, after this, a professional, a degree holder, whether specialty or super specialty, will now need to take a examination which would, as said afore and as is once again displayed on your screen, that would be known as MS bracket NB or MD bracket NB, MCH NB, DM NB. It means that it will be that a same exam that will be conducted by the National Board in that very pattern which we discussed before. That is, now what is happening now? That is, the student goes to an unknown center, there will be 4 unknown examiners, and there the student, or rather the degree holder, whatever it is, there he or she will give that examination, and as regards to that examination, with this pattern, the pattern of the examination can be configured in such a way that it will realize the so-called dreams, that lofty ideas, whatever was there in 1975, those ambitions, those goals, they can be met. How? It is by making sure or ensuring that the sky is the limit as far as the standard of examination is concerned. It means there can be 1 long case, 2 long cases, 3 short cases, 5 short cases, endless number of ward rounds, models, x-rays, specimens, viva, whatever it is needed, that can be asked in the examination. To bring it on par with the so-called Western standard, American standard or UK standard. What is the subtle advantage of this kind of a system? You see, now what is happening, the DNB stream of PGs, those who are doing DNB, either specialty or super specialty, they don't have the security of already having passed MS or MD or DM or MCH. They directly go to this unknown center, unknown examiner. They travel either to Jammu or to Kanyakumari or to Bengal or to Bombay or Rajasthan, and there they give their examination, where already the students who have obtained an MD, MS degree and have very well settled, they too come and take the examination. So they are caught between 2 cannons. One is that there is a huge number of students who want to add 1 more degree known as DNB to their already existing MS, MD, DM, MCH degree. Nothing wrong with that. But having said that, they are on a psychologically better platform. They have already obtained their degree. How did they enter the degree? They may have entered the degree through paying of capitation fee or donation or whatever it is. They have, as usual, as we have already discussed, they have obtained their MD, MS degree with the help of, in their own college, with their professor and head of department being one of the internal examiners. These people, armed with this psychological advantage, armed with the academic advantage, they flock in large numbers to the DNB examination, where the primary DNB candidate, as he or she is technically known as, is fighting a very unfair battle. The bottom line, I know what everybody says, that if you are good, you will pass, whether there are 100 competitors or 2. No, that is not fair. There has to be something that is fair and square. Therefore, this particular system of examination, where there is a pan-India uniform degree that is given, MD, MS, DM, MCA, student obtains a degree. Following that, there will be another MSMD or DMMCH with national board certification. This can be of an international standard, global standard, American standard, British standard, Australian standard. They can escalate the standards to any amount want. They can have 90% failing, 80% failing, to their heart's content. They can have any amount of failure rate, pass percentage, whatever they want to have, they can. So immediately one last question will be asked. Once a student, that is a professional, has obtained an MD, MS or a DMMCH degree with all the securities what you have said, why will he or she go and take that degree? Why will he go and take the degree in some unknown center with 4 examiners? Why will he again go through all these things? You see, it is not easy to hoodwink a system. A person may be smart, but you cannot hoodwink the system, because supposing you are the employer, then 2 people apply. One person would have got the regular standard MD, MS, DM, MCH degree. The other person would have got MD or MS along with MD or MS national board. That means he or she would have taken the courage, taken the initiative, had the dynamism, dared to go ahead and take that examination and crack that examination and obtain an additional degree. Who will you employ? Who will you prefer? Therefore, this is the final format of degree examinations in India that MERC proposes. And as I said, last but not the least, for all the policy makers who want to know how you actually make an Indian degree on par with Western degree. It is not by failing, it is not by setting a very low pass percentage or etc. There is only one methodology to make it on par, to make your Indian degree, to make our Indian degree on par with a British degree or an American degree or an Australian degree. You have 4 examiners. There will be 3 examiners from our nation. You want to make it equal to a British degree, the 4th examiner will be from United Kingdom. You want to make it on par with an American degree, the 4th examiner has to be invited from the United States of America. This will truly and truly internationalize our degrees and fulfill the dreams of creating a system of education which is ultimately on par, if not greater than the Western standards. Thank you.